right now, at least we have on the other side to give us insight on PhilHealth's position. We have on the line PhilHealth Senior Vice President for Health Finance Policy, Dr. Israel Francis Pargas. Good morning, Dr. Ish.
Hi, good morning. Good morning, Attorney Karen, and good morning to Dr. Liachon.
Yes.
And good morning to all. Good morning, everyone.
Dr. Ish, perhaps you can shed light on, one, the reasons for the MOA, and at least answer some of the questions that Dr. Tony as well is raising in terms of the legality of the MOA. So first, what is the purpose of this MOA?
Well, for PhilHealth, well, basically, the MOA is between PhilHealth, the Tingog, and the DBP. But basically, the role of PhilHealth is really to make sure, because our mandate is to make sure that every Filipino is a member of PhilHealth, and that is written in the Universal Healthcare Law, and that every Filipino would have an immediate eligibility to all the benefits of the National Health Insurance Program. And to make sure of that, there should be an access to where these benefits would be given or where they can actually get this benefit. No? And of course, it would be coming from the health facilities, which we are to accredit. So ang atin pong role with the particular MOA is, one, making sure that the members or every Filipino would have an access to all the benefit packages of PhilHealth, and making sure also that we pay these services to our accredited facilities. So ang atin po is really to support the mandate of the universal healthcare to make sure that every Filipino would be getting the access and would be getting the financial risk protection in times of ill health.
And Dr. Ish, in terms of DBP's role, what are they going to do here? Are they going to finance building healthcare facilities in rural areas?
I think the DBP is offering a loan window for the local government to help them finance the hospital operations, one, either through construction of facilities, making sure that the operations of the hospitals are okay and continuous. So yun po yung primary role, I think, ng DBP as a hospital, as a loan window for healthcare facilities.
Okay. And Dr. Ish, what about Tingog Party-list? What is their role in this MOA?
The Tingog Party-list, as they say, katulad po dun sa statement na pinalabas nila, would be part of it through helping the local governments navigate through this program and partnering with advocacy campaigns in making sure that the local government understood the program, that the local government is making sure that they are providing the necessary services once the facilities are already there, and making sure again that the more on the communication and advocacy campaigns for the participation of the local government.
Dr. Ish, but Tingog Party-list is a party list, so they're in the legislative branch. Why do you even need them, PhilHealth and DBP and the LGUs? Why do they even need to participate in this when it's outside of the mandate of legislation or lawmaking?
Well, probably it's one of their causes, or they really want to make sure that that every Filipino would actually get an access to a healthcare facility that are, for a fact that in most or in some of the areas there are lacking of healthcare facilities, and they would want to help in making sure of the success of the universal healthcare.
Dr. Ish,
but we don't put any political color in any of this memorandum of understanding.
And Dr. Ish, there's going to be elections in 2025, and so Tingog Party-list will also be up for re-elections. And based on just the number of party lists that are running, what if Tingog does not win in the 2025 elections? What would happen to their role in the MOA?
Well, again, we never talked about political plans or political action with regard to this. But for the role of PhilHealth, we will continue ensuring that these facilities are accredited, providing the necessary health services to all the PhilHealth members, meaning all Filipinos, and that they are actually getting the rightful services and that we are actually paying for those services, thereby making sure that there is a financial protection for every member. With regard to any political action or plan of the Tingog, well, we never discussed it.
And will PhilHealth be spending any funds in order to implement this MOA?
No, no, no. Because the loan window is being offered by the DBP. Our role is making sure that every Filipino or every PhilHealth member would have an access to these services. Once these facilities are actually improved or constructed, then we will make sure that these facilities are participating in the National Health Insurance Program. And once they are in the national program, then our members can actually go there and get the services, and we will provide the reimbursements so that the members can actually get the financial protection. And for the facilities, will be paid for its services they have given, and also making sure that we are providing sustainability and financial viability for these facilities through our payment.